Today, we are excited to have Dr. Monica Aggarwal join us. Dr. Aggarwal is an assistant professor of medicine in the University of Florida Division of Cardiovascular Medicine. Dr. Aggarwal's own path to understanding the impact of nutrition in illness started soon after the birth of her third child when she developed an advanced form of rheumatoid arthritis. It was only through learning about the microbiome, its impact on the immune system, and the role of nutrition in affecting the gut was she able to truly heal from debilitating physical pain. Next, Monica left private practice and returned to academics in order to pursue research on the role of diet and to create an integrative cardiology practice focused on nutrition and lifestyle. She is the director of integrative cardiology and prevention at the University of Florida and focuses on promoting food as the foundation of healing and for its medicinal value. In her hospital, she is developing a 100% plant-based menu, which is amazing. Thank you so much for being with us here today, Dr. Aggarwal.
It's good to be here. It made me laugh listening to myself, and I was like, who is that?
That's great. So you have learned firsthand the power of nutrition to reverse illness and prevent future disease. So can you tell us about your experience fighting rheumatoid arthritis using nutrition as your weapon of choice?
Sure. So I have 3 kids, and I'm a full-time cardiologist. So after I had my third kid, I went from being an active runner and very healthy, or at least I thought, to being completely debilitated. So around the time I had 3 children under 4. So I had a newborn baby, I had a 2-year-old, and I had a 4-year-old. And so when the baby was born, I was running around like a crazy person all of the time. Any woman can relate to that, which is that I was working all the time. I was pumping in the day. I was nursing at night. I was sleeping very little. And so in that setting of low stress, poor diet, about 5 months after I delivered my third child, I started getting migratory joint pain. It went from very quickly within weeks from being just a sore joint to completely unable to move my feet and legs. I went to a point where I was unable to climb up the stairs. And that I always call that my turning point, where I went from being told that I couldn't manipulate my fingers, I couldn't move my legs, and I literally thought that I was going to be in a wheelchair. I was so immobile. So I went to see a rheumatologist, and after checking my own blood work, I always tell people the story that I was like any good doctor. I treated myself for Lyme disease because without getting any labs done, I went and just said, I must have Lyme disease. So I treated myself for Lyme disease, and I didn't get better. I got worse, and went to get some blood work done, which was very abnormal. I had extremely high inflammatory markers, and my rheumatoid factor and my anti-CCP antibody, which are specific for rheumatoid, were very, very high. So when I went to see a rheumatologist, they told me that I had advanced rheumatoid arthritis, that I had overall, my numbers were so high that I prognostically was going to have a bad outcome, basically. And they said that they weren't sure that I would practice cardiology, and that I needed to get on medications within a week, which is what I did. I got on medications, I stopped nursing my baby, and I got better. So I started taking these highly toxic medications. My hair fell out, and I had trouble with anemia and a metallic taste in my mouth. And but I was better. My joints were better. I certainly could walk, and I could move, and I could manipulate with my small joints. All of those things got better, but I certainly couldn't do any of but I had so many side effects. So I went down this, I went living like this for some time until I met this nutritionist who said to me that she could teach me a little bit about nutrition. And being an obnoxious cardiologist, I said that I was good. I was pretty healthy. I didn't need any help. But she pushed me on it, and I let her do my nutrition evaluation. And she started telling me about inflammation in dairy and about the differences in the types of foods and how they can impact your butt and gut. differently. And it was very interesting. So I started my own process where I started reading and learning about nutrition, the impact of sugar, what triggers the inflammation, what triggers how the microbiome worked. And over a year's process of learning, I decided that I had a genetic predisposition to rheumatoid arthritis, and that I had an environmental trigger that caused it to flare. And so I believed that if I could then calm the inflammation and calm that environmental trigger, then I could potentially calm my rheumatoid arthritis. So I did. I worked on finding that trigger. Most of the time, I think that for people, at least nutrition-wise, that trigger often is something that is often animal products. Often I think it's dairy. It can be other animal products. Sometimes it's sugar, sometimes it's gluten, but different things I think can be triggers for different people. And so I started working on different eliminations until I could figure out what was my problem. Within weeks of changing my diet, sleeping better, taking care of myself more, I felt better. And that began my course down this path of sort of changing and seeing it, gosh, if I can change my own life and suppress gene expression with decreasing inflammation with lifestyle changes, there's so much out there that we can be teaching our patients. I certainly have given out more Lipitor and more medications for cardiac disease and diabetes than as any cardiologist does. But when I started realizing the role of these lifestyle changes, I started then changing the way I practice medicine as well. And so my patients come to me now and we work on lifestyle changes in addition to, and as a complement to their medicines. But it's amazing because people are coming off of medicines left and right and they're blown away. It's been pretty awesome.
This is great. So you touched on the fact that the microbiome is a really important piece of this whole metabolic puzzle. So can you go into a little bit of detail here about how your gut microbiome is affected by the food that you eat and how it's sort of implicated in conditions like prediabetes, type 2 diabetes, heart disease, rheumatoid arthritis? Give us a little insight here.
Sure. So imagine your microbiome. And so just for people who don't know what the microbiome is. So the microbiome is basically your gut bugs, all over your body and your skin and, your vagina and your stool, your anus, you have all these bugs. And these bacteria are changing on a day-to-day, moment-to-moment basis based on infection and what you eat and what you put in your body. So that's actually the microbiota. And the microbiome is actually the DNA that those bacteria have. And if you can, there's 90 trillion bugs in your gut, and those bugs can then have their own genes. And so compared to sort of the human DNA versus the gut DNA or the bug's DNA, where the human DNA is massively outnumbered. So a lot of people say, that the gut is the second brain, or that, we're more bug than we are human. So each of those bugs in your gut changes based on what you eat. So that's really interesting. So we don't exactly know how, there's so many bugs. And so we don't really know about each and every bug yet. It's still being evaluated and discovered. But what we do know is that certain types of proportions are seen more in certain types of eating behaviors. For instance, if you have more of a Western or European kind of diet, you have different gut bugs than if you have like an African or an African village diet. So like they've done studies before where they've looked at the bugs of people, for instance, like of African Americans versus Africans, where there's different morphology or different bugs in their gut. And similarly, when you change your diet, the gut bugs also change. So what's the point? What's the big deal if your gut bugs change? Like, who cares? But it's important because different bugs then are associated with different strengths of the gut. And if you imagine your gut is like it's like Fort Knox, and it has all these levels of the Navy SEALs and the first and second, third layers of defense. And as your bugs change, then those layers of defense also become weaker and weaker. And so we know that people who eat more of a Western style diet, which is a diet that's loaded in refined foods, red meat, dairy, high fat, where they have different bugs and a different gut biome than people who don't eat that way. And so then those layers of defense in your gut sort of start receding away, making it easier for bad infections or bad things to get into your bloodstream. And when it gets into your bloodstream, it triggers inflammation. And inflammation, I will describe inflammation as your body's mad at you. And so when you eat something bad, it changes the bugs in your gut, then it opens up the gut. It causes what we call a leaky gut. The bad toxins come into your bloodstream and trigger inflammation. Now that inflammation, if you do it long enough, can then trigger inflammation all over your body. So for some people, it can become heart disease or a heart attack. For some people, like me, it was rheumatoid arthritis. For some people, it's diabetes. For some people, it's cancer. And so for different areas of the body, so it's one and the same thing. And so I like people to understand that inflammation can go anywhere and can cause any number of chronic illnesses. And so the key is to make sure that you don't trigger that inflammation. And one of the key places where that inflammation can occur is in your gut.
Okay, so this is really helpful. Is your microbiome also implicated in autoimmune conditions like rheumatoid arthritis or even type 1 diabetes?
Oh, sure. So there's data that's come out that shows that if you have what we call a leaky gut, which is when those layers of defense are gone and the toxins can come through, that can trigger inflammation that can go to your joints or that can go to your pancreas.
Yep, got it. There's actually a lot of research now that's starting to show the connection between the food you eat, the health of your microbiome, and your risk for developing a number of, like you said, chronic diseases as well as autoimmune diseases. And, as this research comes out and as more and more information it becomes available to researchers, it's really becoming fascinating to see just the wide spectrum of illnesses that can literally be caused by damage to your gut lining. And, it's really important for people to understand that, once you protect your gut lining by changing the foods that you eat, then, that can be a gateway to making sure that your total body health is maximized.
Absolutely. I mean, a good example is celiac disease, right? Which is a reaction where you have an allergy to gluten, right? And so most people don't have an allergy to gluten, but 7% of the population, 2 to 3% of the population has celiac disease. And so when celiac patients eat wheat, then what happens is it goes into their gut and it gets rid of those layers of defense, and then you get that leaky gut and the toxins come into your bloodstream and you get inflammation. But it's not that celiac disease is just an illness that affects the gut. It's an illness that goes all over the body. So it's just a case in point that what you eat can then go and affect your gut, which then can cause systemic inflammation. So you could see then that just one illness, but you could see how other people could develop rheumatoid. Somebody could get type 1 diabetes. Somebody could get cardiac illness. I mean, there's so many different physiology or pathways that inflammation can trigger illness.
Okay, so can you talk to us a little bit about your experience helping people with pre-diabetes and type 2 diabetes improve their metabolic health? So what have you experienced and what metabolic improvements have you observed?
Oh, it's awesome. So, I mean, getting rid of diabetes is just one of the things that happens when you change your diet. So in terms of dietary changes, often moving people towards eating more plants, eating more fiber-rich foods, and getting out of eating complex carbs instead of refined carbs. When we do those changes, then people are amazed at their alterations. So they eat loads of fruits and vegetables, for instance. They're blown away by the change in their gut. They're like, oh my God, I'm having so many bowel movements. But yes, because there's so much more fiber in their body. And so everything, and getting rid of the refined foods, that's all helping their gut flora and their gut biome. And so if you improve those things, people come in and not only are they losing weight, but they're cutting out the sugars in their diet. There's not a lot of added sugars. And so eating more fiber brings down their cholesterol, eating less added sugar and refined foods, and eating complex foods will allow their insulin level not to activate as quickly, and it's slower over time. I don't need to tell you guys that though. And so over time, the insulin level is activated, but more slowly than with refined foods. And so people see that they're not only losing weight, but their sugars are coming down, their weight is coming down, and their cholesterol is coming down. It's awesome to see the changes that people are making in our clinic.
Yeah, this is fantastic. I love to see that, you're a cardiologist, but yet you're still affecting profound change with the population, with people with diabetes. So
yeah, most of my patients, remember, 30 to 40%, if not more of my patients have some form of diabetes, either pre-diabetes or diabetes. And remember that 1 in 3 people by 2050 will be pre-diabetic or diabetic.
Yeah, that's a scary statistic, no question about it. Okay, so this next question may not necessarily be that fair, but because you specialize in the management of heart disease in particular, but also see a lot of people with diabetes, if you could give us a sort of like top 3 recommendations, top 3 lifestyle modifications that someone could institute in order to prevent the development of cardiovascular disease or type 2 diabetes, what would they be?
So yeah, I mean, it's a hard question because there's so many things that I would want to say in that, and sort of narrowing it down to 3 is a little bit challenging, but let's give this a go. So I think the first thing that I usually tell people to do, I actually make people a pyramid, and everybody knows about the food pyramid. And so I make people a pyramid, and I have the bottom part of the pyramid, and I call that the optimal zone. And then I have the top of the pyramid like that, and I call that the no-go zone. And then in the middle, there's some things in the middle. So if you primarily eat in the optimal zone, then you're going to do great. And so I try to tell people, if they do nothing else to their diet, but they just add in fruits and vegetables, then they're going to make an impact on their diet. It's mostly vegetables than fruit. So I usually tell them to eat, the WHO and the CDC and the AHA all recommend about 5 to 7 servings of fruits and vegetables per day. And remember, a serving is not 3 strawberries. A serving is a cup of uncooked vegetables, a half a cup of cooked vegetables, or a baseball-sized fruit. So if we want to have people eat 5 to 7 servings of fruits and vegetables, and there's even data to say up to 10 servings per day. A lot of people say, oh my gosh, I'm diabetic, I can't eat that fruit, but then we'll go ahead and eat cookies and crackers and, white bread. And so people, to understand that those are also sources of sugar. And if you remove sort of those refined sugars and add in the sugars that come from fruits and veggies, and where you're getting all these other nutrients, it's okay. And people are always surprised by when they remove the refined foods, their sugars are going down despite adding in fruits and vegetables. So one of the first things I would say is add in 5 to 7 servings of fruits and vegetables per day. The second thing I'd probably say would be to take something out of the, the second thing I'd say is I'd probably go into my no-go area, which is I would remove red meat and dairy. Like if you can't remove all animal products, I would at least remove red meat and dairy to start. There's no benefit ever of eating the amount of saturated fat in red meat. And I also feel the same way about dairy in terms of the amount of saturated fat and sugar that you get in dairy, plus the IGF-1 and the inflammation and the inflammatory marker triggers from dairy. So those are the 2 things I guess I would say to remove at least. And if I get a number 3, I would say, or maybe I've already used up my number, but I'll steal one anyway and say that number 3 I would say is try to add in whole grains and legumes and lentils, those kind of things, whole grains, legumes, lentils into your diet. So as you're removing out that red meat, you could add in sort of those foods.
Great, you nailed it. Actually, I wanted to pin you down and only choose a 3, even though I'm sure you could talk about the subject for hours. Simply because at the beginning of the lifestyle change process, many people feel overwhelmed and they say, "Okay, great, I understand. There's 55 changes I should make over the course of time, but that's too much to think about." So what we're trying to do is help people who are at the beginning of this process understand that they don't have to tackle everything right here and right now. And just like you mentioned, there's 3 that you would focus on: eating more fruits and vegetables, removing meat and dairy from your diet, and then also adding legumes. And just those simple changes right there can take care of 80% of the whole equation right there. So that's super helpful.
Yeah, I often tell people that, and sometimes this helps, is that our goal is not to make you vegetarian or vegan, whatever that means. The goal is to get you to move towards that side, which means lots of fruits and vegetables, whole foods. And so if we can even just start changing your palate slowly and slowly, and we get you to one side, then slowly they themselves, that's the first step. And once you start changing your palate, you don't want those sugars anymore. And then sort of the next steps that come are much easier to handle.
Absolutely. Yeah, I think that's actually a really good point, which is that at the beginning of this process, I think a lot of people, some of the feedback that we've gotten from a lot of our clients is that they find, eating more fruits and vegetables and eating less dairy and eating less meat, it just doesn't taste good. It just doesn't taste good because there's sort of adaptations that have happened on their taste buds, and their brain is not necessarily sensing the pleasure as it might have before they were eating.
Right. I hear that a lot too.
Yeah. So do you notice that over the course of time that people who start eating a more plant-focused diet, maybe they don't like it at first, but they start to like it over the course of time, and then it becomes...
Absolutely. I mean, just think about, I will tell people that at the beginning, the foods that I'm going to offer, provide you, or recommend you eat are not going to be your favorite choices. But I will say, just like the same way I'm Indian and I grew up eating Indian food and I love Indian food, you haven't maybe had Indian food. Well, you have, Cyrus, but other people may not have had Indian food, and they may find that that Indian food's not very tasty. But similarly, I didn't grow up eating Thai food. And so when I first had Thai food, the first time I hated it. But it took a few tries of eating Thai food, and now I love Thai food. Or sweet potatoes. I used to hate sweet potatoes, actually abhorred them. And now I love sweet potatoes. So everything's about changing your palate, and it takes time. And I think you just have to remember to allow yourself the time to change and to accept what your body has to give. And then just slowly sort of remember that the goal is to get closer to the other side, which is more fruits and vegetables, eliminating red meat, eliminating your dairy, and getting in those legumes, lentils, beans. And if we can get there, and a lot of people describe they hate the texture of beans. And so I always tell people, like, okay, I understand that, they don't like the texture, that's a palate thing. That's not, and so that is, so I tell people, okay, make a bowl of beans, have a few bites, and then put it away. And then try it again the next day. And slowly they'll try a few more bites. And then by the end, people say that about hummus, for instance. I don't like hummus. And so, but I do the same thing with people on hummus, and they'll say, you know what, 6 weeks later, I really like hummus. So it doesn't take that long to change your palate.
Yeah, I remember when I was a kid, one of my babysitters would come over every so often to hang out with me. And there was one night in particular that my mom fed us Brussels sprouts, and neither one of us liked Brussels sprouts. So we went outside, we took the Brussels sprouts, and we took a slingshot, and we just shot it at the neighbor's house. Right? And now when I go to the grocery store, I get Brussels sprouts and I start to salivate, and they're tasty, and I love eating them. So you're right.
And you feel this great need to go flick them off at the neighbor's house or hit the monkeys with them.
Exactly. Only if we have too much, for sure. So talk to us about the paper that you just published with Dr. Neil Barnard, as well as a number of other physicians, about lifestyle factors that increase your risk for heart failure. Tell us what your research team found and what is new and insightful about your findings.
So we did sort of a council perspective, which means that we're all part of this, the American College of Cardiology Nutrition and Prevention Council. And what we do is we try to take topics that are controversial or there's a lot of confusion about, and we try to highlight them in some of our big cardiology journals. And, we can step back one step, if you don't mind, Cyrus, and I'll say that we already know that the nutrition and there's such a lack of nutrition education in our physicians. And so most of our physicians don't like to admit that they don't know anything about nutrition and lifestyle. And so, but the reality is we don't, and we surveyed this, and we wrote a paper on this as well, where we surveyed the American College of Cardiology, which is a whole lot of cardiologists. And we asked them questions about, how much education they got in nutrition. And it was depressing. I mean, it was 1 to 2 hours. Some people remembered a couple of hours of nutrition education in a 4-year period. And yet all of our guidelines tell us when you're counseling for diabetes or cardiovascular disease, that you're supposed to teach people about nutrition and lifestyle. So most people who spend less than 3 minutes of their visit counseling their patients will say, oh, and you need to lose weight. do diet a little bit, cut your portion size and start walking. Like that's the counseling that most people are getting. And most of my patients' feedback is then, okay, I'll go do that. But of course, nobody changes just with that. It's just not enough information. I mean, people feel lost with that kind of information. So our counsel was sort of designed to answer that need, which is to answer the questions that our physicians just don't have enough information. And so let's try to sort of go and research what's out there in terms of these controversies where people don't understand, and let's get that information out there. So the heart failure paper basically goes through stage A, which is sort of pre-heart failure condition, and goes through and tries to tell us what the evidence is in terms of lifestyle to impact stage A, which is pre-heart failure, and then sort of at treatment of heart failure down the way. And basically it shows what you and I and you and Robbie, you and all of us know, which is that lifestyle works. So for prevention of heart failure, if you manage somebody's obesity, if you work on their diet and shift towards more away from all the things we said, avoid refined foods, more legumes, avoiding meat and dairy, those kind of foods. If you avoid sort of that standard Western diet and you eat more of a plant-based diet, some people call it plant-based Mediterranean, some people call it Mediterranean. I think that there's a lot of people who maybe come on your show as well who say, well, I know that a Mediterranean diet is the best diet. And I always tell people, the answer to the question is somewhere between Mediterranean diet and plant-based diet, or 100% plant-based, but we shouldn't focus on the detail. Like, who cares about sort of that stuff? Because the foundation of the Mediterranean diet is a plant-based diet. So if you focus on eating more plants in general, then you're not going to go wrong. And so I think people sort of get caught up in, I want to follow this diet or that diet because that's what the data shows. Well, actually, the data shows consistently over and over again that eating plants, whole grain, lentils, eliminating refined foods, that is the diet that works. What you do with the sort of other details, well, that's up for debate. But the big picture is that you need to focus on those foods. And so even in heart failure, we found the same thing, is that if you shift towards eating more plants, more of a plant-based diet, that you're going to impact and decrease your risk of heart failure. We showed that increasing physical activity decreases your rates of heart failure in people with a weak heart. There's data that shows that you improve somebody's mortality by just getting them to move more. So getting them, and then we talk about yoga and meditation and the impact of yoga and meditation and Tai Chi and how they can decrease your stress levels and bring down your blood pressure, which also impact your risk of heart failure.
I love how you focus on the big picture here. And that's such a huge point. We've heard that over and over again from several experts. Of course, everybody in this summit, everybody has, maybe a little different opinion on one thing or another thing. But in general, the bigger picture, everybody's on the same page, and just helping people in those changes is kind of what we need.
Yeah, I mean, I think we get too caught up in the details. Like, who cares? The foundation of the diet needs to be emphasized, that this is what we need to be doing primarily. And if you do all of those things, you're going to do super well. It's just that most of us aren't. Because there's a lack of detail or knowledge about the details, people are not doing anything at all. And so what we need to do is come closer to the other side, which is, that's what I try to tell my patients for sure, is that we're not trying to, go from X to Y in 1 second. We're just trying to get closer.
Yeah, makes perfect sense. Okay, so you co-authored another paper recently in the American Journal of Medicine regarding the education of physicians and the nutrition education that they get or don't get. So can you tell us how patients can make good dietary choices when their own physician is not helping them out?
It's tricky. Yeah, it's very tricky because most physicians aren't doing that counseling. So just to review that, we found that physicians are counseling their patients for less than 3 minutes of their physician appointment. Yet there is a data to show that the more you counsel your patient, the more likely your patients will make a change. So we know that if you counsel, it helps you make a change, yet the physician isn't actually doing the counseling. Part of that, I think, is because we are strapped for time, and it's very difficult to be a physician in 2018. but then also we also don't have the education to do it. And so for sure that the patients come in, many patients come in and say, oh, thank you for teaching me this stuff because I haven't been able to get this information anywhere else. And so, yes, it's a challenge. So, I mean, there's a lot of online websites. There's a lot of places where you can get educational materials. We're trying to streamline data ourselves in terms of making packets of information. But your website, I've referred patients to your website. PCRM website, Plantrition, places where you can learn more about eating sort of plant-based foods are all good ways to do it. But yes, it's a challenge. I mean, I started this conversation when we were offline about how when sometimes I'm working with patients who have diabetes, I have to call up the endocrinologist who says, well, you shouldn't be telling them to eat beans because, or if I have to talk to the nephrologist, who's the kidney specialist, who says that the patient can't eat beans because their potassium will go up too high. And I'll say, well, wait, no, hold on a second. Let's talk about that. Is that really true? If I'm taking this stuff away and adding this in, is it really going to affect their potassium? And once we have these one-on-one conversations, people are like, you're right, we can try this. Let's see how it goes. But, and especially in counting carbs and sort of, we have to count these carbs, but then they're focused in on these, and they'll eat these refined foods and they're counting all their carbs, and patients are getting so confused. So I think that sometimes just sort of remembering simple rules that we talked about, the sort of 1, 2, and 3 about what you can eat, using some of the online modalities and finding a physician that will work with you and teach you about who will help you with nutrition. I mean, there are definitely a lot of integrative medicine specialists and functional medicine specialists, but you have to read about them, focus on nutrition, and hopefully everybody can find a resource that they're happy with.
Yeah, actually, I think what you're saying is brilliant, because simplicity is the key. It really is. We've had other speakers in our previous summits, as well as the summit, also say the same thing, that it's really easy to get caught up in the weeds and start to microanalyze, various foods versus other foods, and then read too much information on the internet and just get completely confused. But if you just keep your overall lifestyle change process real straightforward and real simple, focus on 3, 4, 5 things at the most, then you're maximizing your chances of success.
Yeah, I mean, it takes time, but it can be done. Absolutely.
For sure. So last question we have for you here is, what's the number one problem that you see people struggle with when it comes to actually changing their lifestyle? And what would you recommend to overcome that problem?
I think I couldn't say that there's one thing that everyone suffers from. It's very interesting when I run my clinic, because I ask patients questions, stuff like, are you happy? What makes you happy? What doesn't make you happy? And I ask these questions in my clinic, and everybody sort of has something different. And some people's stress levels are very high. Some people aren't sleeping. Some people are overworked. Some people aren't moving at all. And then in terms of nutrition, if I were to say something about nutrition, I think there's certain people have different problems. Like some people wake up in the middle of the night and they're bored, so they eat. And there's certain people who love their soda and they won't give up. They can't imagine a life without soda. And other people, and probably if I actually would say the thing that people have most trouble with is they say they can't give up their cheese. Cheese is the one thing some people love cheese. I would say that 7 years ago when I stopped eating cheese, I cried. I cried because I was like, I can't give up my pizza. But I think that the key is that I'll tell people that a lot of times you have one life to live. You have one life to live, and if the foods that you're eating are making us sick, that's the truth. The foods that we eat in America in 2018 are making us sick. And so I always ask people, what's it worth to you to get healthy? What's it worth to feel like you are 70 years old or 60 years old or 80 years old and that you can walk and not complain about your joints or not have to take 10 medications? What's it worth to you? And is it worth opening that one soda or having all that cheese? Is it worth all of that? And obviously most people say, when they think about it, they say, well, you're right. It's not worth that. It's not worth the food isn't worth it. And so sometimes just sort of keeping, sometimes I tell people to make a positivity journal, sort of write down positive things that have happened in their day to day, just to sort of say, these are the things I was successful at. Oh, I was able to eat 3 vegetables today, or, you know, it wasn't that bad. And sometimes just saying positive things to yourself helps. I mean, it takes time. And I think things are, you have to accept who you are, accept how your body will change. You have to accept that, but that there's only one chance at this. And so I think that you start building plaque in your heart arteries when you're 5 and 6 years old. So there's no time that you should be starting early. You should be having your kids change. And then every time you have a moment where you want to have your cheese, go find something that is a nice alternative and try to be creative. And a lot of times people who love chips and hummus or chips and guac, I'll say, well, why don't you slowly change that to pita first? And then, oh, you know what I do is I actually take mushroom caps, and then I take the mushroom and I scoop it in the hummus. And that's a really good option. And so people start slowly seeing different options. I don't know if I have a good answer for you. Maybe didn't answer that just right. I just think that there's so many different things that people struggle with. And sometimes I feel like if I just say, well, yeah, you know, you got one life, let's try to work this out and give people opportunities. I don't want to see them in the hospital. I have a great cartoon actually of a patient who we say to them that they need bypass surgery. And so it's a cartoon. It's not my joke, but it says, if there's a guy who's talking to his cardiologist, and the cardiologist says to the patient, sir, you need bypass surgery. We're going to cut your chest open. We're going to take veins from your legs. We're going to attach them from the blood vessels that we're going to in your blood vessels in your heart. We're going to take those veins and we're going to put them in the blood vessels in your heart. Then we're going to sew you back up, and we're going to put you on 5 or 6 medications. It takes about 6 weeks to 3 months to heal. It costs about $100,000. Or we can put you on a plant-based diet. And the patient says, gee, doc, vegan diet or plant-based diet, that seems pretty extreme, you know, and you're like, huh. You know, and so, right. So like, so funny to us when we're listening to it, but isn't that sometimes so much what we hear, or at least certainly what I hear in clinic, which is, wow, like giving up my Coke, that's like, really, why would I want to do that? It's what I live for. And the other thing I also say to people, which may or may not help the patients, and it's not meant to scare people, but it's meant to sort of be real, which is like people say, well, I only live once. I'm just going to seize the day and live it up, and I'm going to eat the things I want to eat, and what happens will happen. But everybody thinks that they're going to just have a heart attack one day and then they're going to die and then it's over. They're going to go to bed one day and not wake up. I know this is kind of morbid, but that's what people think. And so I always tell people in clinic, I'll say, well, you know, that's not how it actually happens, right? It actually happens where you have a heart attack and part of your heart dies, or you have a stroke and part of your body dies, or you have kidney disease and your kidneys start failing because you didn't control your diabetes, or you lose your eyes and then you can't see. And so it happens with all these, it doesn't happen sort of quick and instantly. Chronic illness comes on insidiously and hurts one part of you, and you keep living, but you live at half of you. And I don't think anybody wants that life. And when you kind of think about things like, oh, well, if I just change my lifestyle, or I could possibly have a life where I can't feel one side of my body, it's like, oh, okay, it's worth it. I'll make the changes I need to make. And sometimes you have to hear that in a sort of a tough way, because that's how it happens. I mean, I see this every day.
Yeah, I think that's actually a really good. One of the things that you said that I love is that you know, what's it worth to you, right? What's it worth to you? It's a powerful, powerful question that may not have the same answer for every single person. But if you really take the time to sit there and evaluate, well, you know, is adopting a plant-based diet, is it really that extreme, right? Or is having my chest cut open and veins pulled out of my leg and rerouted around my heart to redirect blood flow? That could be a little bit more extreme for sure. So, point being, the true improvement in recovering from cardiovascular disease, or preventing cardiovascular disease, or recovering from prediabetes and type 2 diabetes, or preventing them in the first place, it doesn't have to be complicated. It really doesn't have to be complicated. It can be very simple. It can be very straightforward, and it can just follow a couple of very simple principles. And when you follow those principles, that's the bulk of the work right there. And I think you've done a really good job of sort of like explaining that But also one thing that I wanted to say too is that, when we were talking offline, you told me about the fact that you used to be in private practice and that you decided to change your career path and go back into academia and really start to advance the scientific rigor of this plant-based world. And I think that is so, so important. And so, it's noble of you, but it's also, you have a true desire to want to improve the, the knowledge in this field and try and advance this field as a whole. So if we haven't said so already, we really appreciate all the hard work that you're doing. And
thank you. I mean, I would tell you it's selfish, right? Because I need to know that the lifestyle changes I made, they were real. They meant something, that they didn't just happen. It's not, I need to understand why the lifestyle changes that I did for myself, they made me better. And so that I can, once I understand that, I'll know how to better treat people. So doing the research and getting the word out there, I have all selfish desires as well.
Actually, it's funny you say that, because I would argue the same thing. The reason I went and got my PhD in the first place was because I wanted to understand if what was happening inside of my body, if I was just a freak of nature, or if there was something that was much larger at play. So I know exactly where you're going. I still appreciate all of you, and I'm looking forward to reading every single one of your publications and new ones that are about to come out as well.
Thanks so much. It was good to be on here with you guys.